clinic gets a lot of everybody's attention because it's a part of the healthcare plan here that you can see, feel, and touch, and you interact with. But the clinic is only a part of our overall structure of this plan. You still have a normal healthcare plan that covers all the range of benefits, and nobody is forced to come to this facility. It is strictly your choice.
How are you, Mr. Ellison?
Hi, Heather. How you doing?
Fine, thank you. We'll be right with you.
We did the grand opening and started operation in January of 2004. All of the services here, which range from treatment of the common cold to minor surgical procedures that are done, are all free of charge to the member. There's no deductibles or co-pays or any of that sort of stuff.
For the premiums that we pay, you know, coming over here and having blood work done for free, if you need x-rays, they're free.
Where does it hurt you the most?
$250, $300 for a chest x-ray at a local facility in Beaumont, we can do for $1.50, you know. We use our own staff, our doctors read our x-rays, and it's just a big cost savings.
About 2 years ago, we added another feature. We're giving away some medicines here in the clinic. We're stocking them, especially for long-term medicine for type 2 diabetes and high blood pressure and high cholesterol. I think we've been pretty successful in keeping the cost down.
We're in a rural area, so Dr. Cummins, if he prescribes it, we can dispense it here.
We found that by buying drugs on a wholesale level, repackaging them here, we can pay for these services at pennies on the dollar. You know, you continue to do the same things you've always done with respect to how we pay for health care. The costs are just going to continue to go up. So you've got to be doing things differently if you expect to have different results. We've made it extremely accessible. The average American spends about 1.2 times a year in front of a doctor. In our group, we push about 5 times.
People will sometimes tough it out and say, well, I'll get over this. And honestly, they may actually drive themselves into more illness by not taking an early shot at it.
Right now, if you want to see a doctor, it's going to be at least 2 weeks or a month. Here, you're only a phone call away.
I think that if I hadn't come when I did, I don't know how far along my cancer would have been.
Right.
And so it was a blessing. This clinic has been a blessing to our family.
So I could sit here all day and tell you one story after another. My wife was sick for 7 years, and during that 7 years she had 28 major surgeries. And so I say all that to say this, is the staff helped me through that situation, and they know my gratitude because I've told them and showed them many times. It's kind of like family here.
There you go. That's a better word for it. Family.
All of our patients are like family to us. When they hurt, we hurt. When they're happy, we're happy. You're not just a number. You're not just on the books for today and we don't see you in another 6 months.
The sole reason for the existence of this staff is to provide healthcare services to our union members and their dependents. So there's a tremendous difference in the conversation between a union rep and its member versus a member and an insurance company.
There's no extra fees. You know, we don't live in a 100-story high-rise building down, you know, in places like that.
We really have more of an incentive to keep the costs low here. We're not raking off a share off the top. We're basically managing health for people that we know and care about.
We have the member, we have the administrator, which is essentially his insurance company, and we have this medical facility, vertically integrated, all on the same team.
And when the people that are actually getting the benefit also get to manage it, believe me, the outcome is totally different.
This is our clinic. Our people came out and worked to put this place up, the parking lot. Every bit of stuff that's done out here, we did ourselves. So, you know, some people like to say our blood, sweat, and tears went into this place.
Now, while we spent a lot of time talking about the cost savings in this plan, the real story that kind of goes unnoticed is that this clinic has actually been responsible for saving lives. Our members have not had to pay an increase in healthcare costs in 7 years, while the rest of the industry has doubled in cost.
You show me where you could go 7 years without an increase. Can't do it. No one out there's done it. And no one, whether they're paying premiums like ours or close to ours, their coverage isn't like ours.
Sure, I can get cheaper insurance, but I'm not going to get all the benefits that I'm getting right here.
Healthcare is a very personal benefit. It goes home to the wife and kids. And when they come up here and they actually see their union dollars being spent in such a constructive way and helping to take care of their loved ones, it's a powerful thing.